Hey everyone, this is Monica Du again, pediatrician here. I wanted to go ahead and talk with you about vomiting and diarrhea. Now, vomiting alone in association with your common GI bug is going to be called your gastritis. And then vomiting with diarrhea together is often called your gastroenteritis. So if you ever hear those medical terms, that's pretty much what they mean. Now, vomiting and diarrhea is often, most of the time, it's going to be caused by a viral bug. You know, a little pesky bug that has gotten into our system, inflaming our GI tract and just causing us to have an unsettling, queasy, nauseous feeling in our tummy, even associated with lots of uncomfortable cramping, gassiness, bloating. Those can all be some signs that a GI bug has taken its home up into our GI tract. Um, Now, just to give you some other signs about what can happen with vomiting and diarrhea, you can also have a fever at times. You may also have, of course, your obvious loose stools, relentless, just not letting up. Infants, if they are having persistent vomiting and diarrhea, they may become dehydrated very quickly because they don't have the reserves like you and I to kind of maintain their hydration. And of course, they can't maintain their own fluid status without our help. So some of the signs that we may see in them are a sunken fontanelle. Now that fontanelle is that little soft spot that you have to be so careful with right at the top of their head. That may feel sunken in. Their skin may be, of course, dry. Their lips will be dry. They're not making good tears. Their mouth may be dry inside. Tongue is looking kind of pasty. Of course, obvious things too, decreased wet diapers, just loss of lots of fluid. So that normal supple look that they have, nice, juicy mouth that they have is not going to be present anymore when they are showing signs of dehydration. Now with the older child, they may start to also look dry. Of course, they're going to have decreased urination. They just may be very fatigued, tired. They just want to lay around. Your normal hyper or energetic child may just want to sit down. They don't want to be bothered. They may start to tell you, oh, they're feeling nauseous. They have cramping, belly pain, all of that. Those are some signs and symptoms that can be associated with dehydration and vomiting, diarrheal illnesses. So, when this happens, what are we supposed to do to just help them until they get over this assault to their GI tract? The mainstay is you want to keep them hydrated. You want to make sure that the fluid that they're losing will be replaced. So that means you want to go ahead and give them your general electrolyte solutions. Now, we also often hear about the Pedialyte. We often hear about Gatorade too, but for our small babies, infants, toddlers, and so forth, Pedialyte is a very good choice for electrolyte solution, or if you have a generic equivalent that can be efficient just as well. And what you want to do with the babies is you want to give just small amounts, small aliquots. And that means even if you have to get your medicine syringe and just push in small amounts every now and then, every 30 minutes to an hour, just to keep them hydrated. That's what you got to do until they're able to take on their regular foods. Now, breastfed babies, go ahead and breastfeed them. That would be perfect for them if they can tolerate it. But if they're not tolerating the breast milk, or for formula fed babies, if they're not tolerating that, if they're still having lots of profuse diarrhea, still vomiting, you have to let up on it and just do the replacement solutions like electrolyte solutions that I was talking about. And for the older children, go on ahead, give them the Pedialyte too. And then if they don't tolerate that, if they prefer Gatorade, you can do that. But the only thing is that Gatorade has a much more sugar than the Pedialyte. Pedialyte is a little bit more balanced with replacing the electrolytes that are necessary, like the sodium and potassium, and then of course it has dextrose in there, which is a good sugar to use when you need to replace fluid losses and the sugars and so forth that get lost from all the diarrhea and vomiting. That one is the pretty good one to use versus the Gatorade, which is fine, but it just has a little bit more sugar content and less sodium in there. So, that's just few things that you can do. And then, of course, not many people know, but when we have a bug in our GI system, there's inflammation there, and that GI tract does not want to take in regular food. So please don't give them sugary drinks, don't give them any ice cream, don't give them milk, don't give them any heavy fried foods, cheeses, and all that, because it's just going to upset their tummy, and then it's going to make it sometimes even worse in terms of the symptoms. They may start vomiting more. They might start having more loose stools. So you want to back off on that just for about 24 hours and just give the replacement solutions that you can get. This one is over the counter, by the way. It's not a prescription needed. Just give them replacement solutions and then light foods. So that means things like clear broths. You can do crackers, jello type treats, ice pops. That's a good one too. Good tip to know for the older child that doesn't really feel like drinking much. They might definitely take on to the ice pop because that's kind of a treat for them. And then a replacement too. They have electrolyte ice pops that you can get over the counter also. So definitely keep that in mind. And then, of course, things, kind of red flag signs to think about. Fever is climbing, persisting, it's not going down after 24 hours. The vomiting is just not allowing them to be able to even keep down the small aliquots of fluid that you're giving. And for the babies, like I said, the little small aliquots that can be given in the medicine syringe. And then for older children, of course, little sips, little sips. If they're not able to keep that down, it's persisting. Those are red flag signs. Looking even more dry and very tired and fatigued. Those are red flag signs. Of course, bloody diarrhea, blood in the vomiting, those are never good signs, so if you have any of those, then you can't manage at home anymore. You have to let them see a physician. Let them see a pediatrician, or someone that can take care of children, so that they can have a full evaluation. Sometimes we may even need to do stool studies. That means taking a sample of all that diarrheal substance and test it for certain bacterium that actually more so in infants can pose a risk for toxicity to their system. So, if things are relentless, it's not letting up, it's associated with any of the red flag signs, go ahead and bring them in, let someone take care of them, because dehydration can be a very serious thing. And so we want to make sure we can prevent that and make sure that we nip things in the bud before things get worse on us at home. So that is pretty much kind of mainstay of, at-home treatments, and then things to look out for in, our infants and then toddlers and older children. And, this can be combated, but it's just we have to know what to do so that things don't get worse on us at home. So, hang tight if you're going through a situation like that. Just follow the steps I talk to you about. And if things are not looking right, go with your gut. Your child. Bring them in so that they can be seen. All right, see y'all later.